My name is Mollie Shreiner, and I will be presenting about complementary and alternative therapies for children with disabilities. Throughout the presentation, you will use the accompanying worksheet in order to guide your decision when determining answers to the challenge activity. For this challenge activity, you will pretend you are a physician giving parents options on possible CAM treatment methods for their child. Your patient is Sarah. Sarah is a 6-year-old girl with cerebral palsy. Sarah's parents are looking into possible treatment options in order to improve Sarah's mobility and overall health. The family wants options that have been researched and are considered safe. Sarah is the youngest of 3 children. Her brother and sister are extremely active. Sarah's parents want her to be active as well. What types of treatments might you consider for Sarah? I included this slide because these definitions will be pertinent throughout the presentation. Conventional medicine is a system in which medical doctors and other healthcare professionals such as nurses, pharmacists, etc. treat symptoms and diseases using drugs, radiation, or surgery. Complementary and alternative medicine, CAM, is a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine. Complementary medicine is typically used together with conventional Western medicine. Alternative medicine is used in place of conventional medicine, used in Chinese medicine and Indian medicine typically. And integrative medicine is a practice which combines conventional medicine and types of CAM treatment. So here are some statistics on CAM treatments. Over half of children with developmental disabilities receive at least one form of CAM treatment. Approximately 12% of all children have received some form of CAM in the last 12 months, with significantly higher rates among patients with chronic medical issues. And CAM has been studied in children with a diagnosis of ADHD, ASD, autism spectrum disorder, CP, cerebral palsy, and Down syndrome. The 4 categories of CAM include biologically based practices, mind-body practices, manipulative or body-based practices, and energy-based practices. We'll get more into depth with each of these categories throughout the presentation. Let's start by looking at biologically based practices, which includes diets, vitamins or supplements, and hyperbaric oxygen therapy. Some diets that are typically used in CAM include the gluten-free, casein-free diet, which is a diet in which you remove all wheat and milk products. It is commonly used in children diagnosed with ASD. Its effectiveness is not supported by research. There's a risk of inadequate intake of vitamin D and calcium, and children with ASD typically have lower bone density, which is why this type of diet is not recommended. Some suggest that the use of dietary restrictions and changes could treat the symptoms of some developmental disabilities, such as ADHD and ASD. There's also the Feingold diet. It's a diet in which synthetic colors, flavors, and artificial preservatives, salicylates, and sweeteners are removed. It's used for children with a diagnosis of ADHD or autism. It is a very controversial diet, although some research suggests that this type of diet may actually reduce hyperactivity in children with and without ADHD. But it is important to note that restricting sugar does not significantly improve symptoms of ADHD. Vitamins and supplements, the use of multivitamins and vitamin C, it has unclear health benefits, but it is considered safe and recommended by most healthcare professionals. The mega vitamin therapy is the use of 1,000 times the daily recommended dose of certain vitamins. It has many side effects, and there is a risk of harm when doing that type of therapy. There is a chelation therapy. It is the removal of metal from the body through medicine. There are many side effects and risk of harm with this type of therapy as well. There's also antifungal treatments, which is the use of medication to treat yeast overgrowth in the GI tract. And there's many side effects and risk of harm with this type of treatment. And the last type of treatment is melatonin treatment, which is an over-the-counter medication to help induce sleep, and it is considered safe and shows benefit. Melatonin actually helps in reducing time for onset of sleep with children with ASD, developmental disabilities, and Fragile X syndrome. There is also hyperbaric oxygen therapy. This is the use of compressed oxygen to treat illnesses such as carbon monoxide poisoning. The benefit for children with disabilities is it saturates the tissue with oxygen and can possibly help reduce some neurologic damage. It is available with a prescription. There is little known evidence on the effectiveness of HBOT. Possible risks include ruptured eardrum and increased risk of seizures. It is generally discouraged due to risks, costs, and time, although some families can actually or have been known to purchase the machine for their home in order to cut down on time and overall costs in the long run. Moving on to the category of mind-body practices, which includes biofeedback or electroencephalogram biofeedback, auditory integration therapy or training, and music therapy. Biofeedback or electroencephalogram biofeedback is a process in which a person is provided information about a physiologic process, and they attempt to gain control over that process in order to improve mental functioning and performance. The overall goal is to help induce the child's relaxation response, and possible treatment option for children with a diagnosis of ADHD and ASD. It is considered controversial, but is gaining some evidence for effectiveness. When doing this type of test, the person's heart rate and blood pressure and skin temperature are monitored using a biofeedback equipment. The child then watches the computer screen and receives immediate feedback as when they see their relaxation response on the computer screen. And then auditory integration training is a training in which children with sensory integration disorders are monitored for sound sensitivities and then are given a program tailored to them which filters out the sound frequencies to which they are sensitive. It is conducted over several months and can be costly, and it is not recommended by the American Academy of Pediatrics. And then there is music therapy. A musical experience is delivered by a therapist in which interpersonal exchanges are surrounded by rhythmic tones and music tailored to the child's individual preference. Only some reports of use of this therapy and not studied for the effectiveness at this time. And now moving on to the 8 subcategories of manipulative body-based practices, which include massage therapy, craniosacral therapy, osteopathy, chiropractic, hippotherapy, patterning, yoga, and sensory integration theory. Massage therapy is a type of therapy in which the body is manipulated to help relax and promote healing of the tissue. It is considered safe, and there is some evidence to support that massage therapy may relieve symptoms associated with ADHD, it may promote sleep and lessen repetitive behavior with ASD, and it may also improve motor functioning with cerebral palsy. It is very promising in also relieving some symptoms of certain developmental disabilities. Moving on to craniosacral therapy. It is a therapy in which a therapist is able to sense the waves of the spinal fluid and massages the patient in order to manipulate these flows. No studies have confirmed the effectiveness of this type of treatment, but it may offer some relaxation benefit. Osteopathy is a treatment in which the joints, muscles, bones, and fascia are physically manipulated in order to promote healing. Studies have shown that osteopathic treatment may improve motor functioning and quality of life for children with CP. And chiropractic treatment is a treatment in which manipulation of the spine is used to treat various conditions. There's no scientific evidence to support this method. Adverse effects reported include subarachnoid hemorrhage, quadriplegia, and vertebral dislocation. And the cervical spine of children may be particularly susceptible to injuries, so that is something to consider when thinking of this type of therapy. And patients with chronic motor disabilities and Down syndrome should be warned of the risks associated with chiropractic manipulation. The next type of therapy I'd like to talk about is hippotherapy, also known as therapeutic riding. It's horseback riding therapy. It promotes core strengthening, development of gross and fine motor skills, balance, and coordination. And research shows noted improvement in motor skills for children with CP that engage in a program at least 16 weeks in length. And next we'll watch a short video clip explaining the benefits of hippotherapy and the overall enjoyment that many individuals with disabilities have when working with these animals.
Today is the best day of the week.
Before we even leave home, it's an expectation. It's Saturday, we're going horseback riding.
This is Maryland Therapeutic Riding, a place where horses and therapists help people with special needs, like Selena.
I come here for many reasons. Main reason is therapeutic, to get my core strength and balance and trunk control up to snuff.
More monkeys jumping on the hair.
Lily has lost the ability, her speech ability. She's gone from 500 words when she was 5 years old to a couple of words today.
It's so exciting for me to see his growth and the changes, and I feel like it's opened doors that wouldn't have been open without this program.
One fell off and bumped his hair.
Using horses in therapy means much more than learning how to ride. Therapist Michelle Sanger.
I'm actually using the movement of the horse, its three-dimensional movement, to actually help give her neurofeedback to stimulate her neuromuscular pathways.
In patients with difficulty walking, the movement on horseback simulates walking and stimulates core muscles. Therapist Deborah Taylor.
The benefit is manyfold because not only are you working on fine motor, you're doing it on the horse while it's moving in uncomfortable positions.
That uncomfortable position forces riders to engage seldom used muscle groups. The results are inspirational. Executive Director Ken McCready.
The things that you see here are miraculous. They're just little miracles every day that happen in people's lives, and you see it on the riders' faces and what they're able to achieve or what they're able to learn, the fun they're having.
And that's the trick, having therapy disguised as fun.
A lot of these participants can't do other sports. They can't play soccer. They can't play basketball. They can't do a team sport.
But on Saturdays, these horses train and empower.
Freedom. Freedom in many aspects of the word. Freedom to just feel the movement, be in the moment, accept what is, and just kind of go with the flow.
These three are as different as their special needs, and while this time on a horse doesn't cure them, it brings joy. And for a few hours on Saturday, the rhythms of normality blend into the gait of a horse. Arash Arabasadi for VOA News.
The next type of therapy that we're going to talk about is patterning. It is a movement therapy in which the patient's brain is taught the developmentally normal motor movement sequence through which the movements are facilitated by a therapist. Open trials have shown no benefit of this type of therapy, and the problems associated with patterning include the fact that it is a very intensive, time-consuming therapy and the large cost. Next is yoga. It is a body-based practice that combines postures, breathing, and meditative practices to help achieve a sense of well-being and physical health. Research has found that regular yoga increases cognitive performance in children with an intellectual disability and has a positive effect for hyperactivity for children with ADHD. And the last one is sensory integration therapy. It is a therapy in which the patient is exposed to various sensory-based experiences such as swinging, joint compression, brushing, holding, and squeezing. The program is designed to address hypo or hyper responsiveness to stimuli, and no clinical trials of procedures at this time. It is considered safe, and children with sensory integration problems should be handled appropriately, though. Children with sensory integration problems still need behavioral reinforcement, so it is important not to just attribute problems to handling sensory input and get away from the behavioral aspect of it. And the last category for CIM treatment methods include energy-based practices, and the subcategory of that is acupuncture. Acupuncture is the insertion of thin needles at certain points in the body in order to reduce pain and restore flow of energy. There is growing research to support use of acupuncture for chronic pain. It has been found that it may increase physical functioning for children with CP, and it is considered safe when used as part of a comprehensive plan. Now let's revisit our challenge activity. If you remember, you are pretending that you are a physician, giving parents options on possible CIM treatment methods for their child. Your patient is Sarah. Sarah is 6 years old. She has cerebral palsy. Her parents are looking for possible treatment methods in order to improve her mobility and overall health. They want options that are safe and have been researched, and they want her just to generally become more active. So what types of treatments might you consider for Sarah? Take some time to pause the video and review your note sheet and use the empty square in order to record possible answers to the challenge activity. The 5 answers that I came up with for the challenge activity included massage therapy, osteopathic manipulative treatment, hippotherapy, yoga, and acupuncture. The biologically based practices of diets, vitamins, supplements, and hyperbaric oxygen therapy, I ruled those out because many of these treatments may be considered extreme and possibly unhealthy. The only treatment I would consider from this category would be melatonin if Sarah were having difficulty sleeping. I could also rule out many of the mind-body practices because many of these methods do not directly pertain to a patient with cerebral palsy. In the manipulative and body-based practices, I would recommend massage therapy, osteopathic manipulative treatment, hippotherapy, and yoga due to their ability to improve motor function, help Sarah to become more active, and or their research-based trials that show improvement for children with CP. And then in the energy-based practices category, I would recommend acupuncture as well due to the evidence that it increases physical functioning for patients with CP. It is important to note that these treatments should not be done just by themselves. They should include regular visits to a doctor in addition to this, and it should be overseen by the general healthcare physician. Here are my references. I hope you learned a lot about complementary and alternative therapies and have a better overall understanding of the types of therapies and what they may involve for a child with disabilities.